So good afternoon. Uh, I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There'll be group pictures at the start and end of the pep talk, so please show your face in the video. As a reminder, after the pep talk, please take the online learning cum evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this one shown here. So I have placed the link in the chat box. I'll put it again later on. Okay. Another reminder, 50 OLETE certificates will entitle one mentee to a free voucher for a ROJoson medical consultation, either face-to-face or telemedical. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please show your face on the video. Okay. So everybody on? Patricia, who's Patricia? Okay. You want to show your face, Patricia? Okay. Ready? One, one, two, three. Mhm. So here's the link to the Olete. Okay. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021 during the COVID-19 pandemic. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. So this shows the content of the core course. And then from October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer, depending on our enthusiasm, discipline, and perseverance. So we're actually reaching the 3rd year, the end of the 3rd year on May 15. My pep talk today is entitled Goiter Awareness. This is my contribution to the Philippine Department of Health Goiter Awareness Week, which is being celebrated on the 4th week of January. The empowerment objective is for the lay people to have a basic understanding of thyroid goiter in their health management. The contents of this pep talk will be the following. What is a goiter? What are the different types of goiter? What are the causes of goiter? How to recognize goiter and its different types? What paraclinical diagnostic tests are usually done for goiter? What are the usual treatment for the different types of goiter? And what are the post-treatment management of goiter? So a disclaimer, I'd like to say that the content of this pep talk will be a reflection of my thoughts, perceptions, opinions, and recommendations gotten or culled from my own personal experience as well as from other professionals. Let's start with the first topic. What is a goiter. So this shows the configuration of the thyroid gland, okay, which is usually involved in the goiter. Okay, so it's located on the neck. Okay. So loosely speaking, a goiter refers to something wrong. Something is wrong with the thyroid gland. And this thyroid gland, as you said, as shown here, it's a butterfly-shaped organ located at the base and central sa gitna ng leeg of the neck. And goiter is defined as any disorder of the thyroid gland. Anumang problema sa thyroid, it's called a goiter, loosely speaking. The thyroid gland is a vital organ. When you say vital, that is needed to survive. Kung walang thyroid gland, hindi magsusurvive isang tao. That regulates the metabolism, growth, and development of the human body. The thyroid gland makes, releases, and controls thyroid hormones. May pinoproduce ng thyroid hormones that control the metabolism in the body. And metabolism is defined as the process where the food taken into the body is transformed into energy. So this energy is used throughout the entire body to keep many of the body systems working correctly. So kung kulang ang hormones, magiging hypothyroid, magiging there's hypometabolism. Kung sobra naman, magkakaroon ka ng hyperthyroidism. So to summarize, goiter is simply defined as any disorder of the thyroid gland. Kung may mga problema sa thyroid, we call that a goiter, any type. What are the different types of goiter? Goiter can be classified into several categories. One, by clinical presentations, how they present to the physician or on the patient's body, whether it's diffuse or nodular goiter, which I will define later on, euthyroidism, hyperthyroidism, or hypothyroidism. And then the other category is that it's being categorized by the general categories of diseases, like whether it's cancer or not cancer, or hyperthyroidism versus hypothyroidism. And then, of course, it can also be categorized by the name of a specific disease. So 3 ways, okay? But the most important here is that in the end, it has to be, if there is a goiter, it should be identified by a specific disease. Minsan, before the identification of the specific disease, ang ginagawa na lang, whether diffuse siya or nodular, euthyroid or hyperthyroid or hyperthyroid, hypo, or sasabihin kung cancer or hindi, without telling which particular type of cancer is present. The clinical classification of goiter would be like this. So pag kinapa yung thyroid gland, din-examine ng thyroid gland by the doctor, they can put four clinical classifications. No? When I say clinical, yung pag-examine ng thyroid, kakapain lang yung leeg at titingnan, at kadalasan, merong kasamang pulse rate determination and also asking for the symptoms of the patients kung may mga simptomas. So clinical means it's based on the symptoms and signs only. Wala pang laboratory ito. So first clinical classification, it's called diffuse toxic goiter. So when you say diffuse enlargement, this is almost symmetrical enlargement of the thyroid gland. Diffuse non-toxic goiter. The first one is diffuse toxic goiter, because when you say toxic, hyperthyroidism. Diffuse non-toxic means hindi siya hyperthyroid. Okay, but it can be either U or hypo. Okay. Nodular toxic goiter, may nodules, may hyperthyroidism. Nodular non-toxic goiter, nodules without hyperthyroidism. Okay. It may be euthyroidism or hypothyroidism. So ito yung 4 na clinical classification which is commonly used by doctors in medicine. Now, diffuse toxic goiter, diffuse non-toxic goiter, nodular non-toxic goiter, nodular toxic goiter. I will expound on this in a little while. Ito yun, no? So when you say the thyroid gland consists of two major lobes, one right lobe and left lobe, no? So these are not perfectly equal in size. Usually the right side is slightly bigger, pero more or less pareho silang in size, more or less, no? So if the whole thyroid gland, the whole one, nag-enlarge siya, we call that diffuse. Okay, this is illustrated here. Okay, malaki siya. Okay, ganun din dito. Ito supposed to be the normal size of the thyroid gland. Ito yung outlined by the black lines. And then nag-enlarge siya. No? So this is diffuse goiter, diffuse enlargement. Okay. Nodular naman, when you say nodular or nodules, presence of buccal, nodules, lumps, or dominant masses. No? Parang ito, dito sa right lobe, may mga bukol-bukol. Dito sa left lobe, may isang bukol. Dito naman, all the two lobes contains a lot of bukol. No? So minsan, yung isang lobe, malaki, pero hindi nakakapa yung bukol na yon. Pero we still consider that as nodular because pag inopera niyan, pag in-examine yung lobe, usually may mga bukol, hindi lang nakakapa. No? Okay. So, ang baseline definition of diffuse goiter is almost symmetrical enlargement. Anything that deviates from that definition is called nodular goiter. So, one lobe is larger than the other side, no? Okay. Basta 2, 3 times, 4 times, no? Kung 1.5 lang, baka symmetrical pa rin yan, no? Okay. So, to repeat, this is a normal size thyroid gland. Diffuse is yung two lobes are almost symmetrically enlarged. Okay. Nodular goiter, one scenario is mas malaki yung isang lobe. It can either be right or left, pero usually 3, 4 times bigger than the other side. And of course, the other definitions of nodular goiter, maraming bukol-bukol. No? So when you talk about diffuse enlargement, you start thinking of whether the patient has hyperthyroidism, hypothyroidism, or euthyroidism. So depending on whether there are associated signs and symptoms that would indicate hyper, hypo, or no associated symptoms that will say normal yung function. Okay. When you have nodule, mga bukol-bukol formation, we start thinking of cancer, possible cancer, malignant or non-malignant disorders. Okay. So diffuse, usually walang pinag-uusapan na cancer o hindi. No? Pag nodule, meron. Okay. Pag diffuse, ang pinag-usapan kung hyperthyroid or hypothyroid. Common diseases that are usually diagnosed which can be recognized clinically and relatively common in the community. No? When I say recognized clinically, malalaman ko na even without the laboratory test. Okay? So these are the entities that I can easily recognize. Hyperthyroidism, the so-called one category is Graves' disease, which I will expound later on. And then the other one is hyperthyroidism, unspecified. It's not called Graves' disease. Graves' disease is a special category kasi yun ng hyperthyroidism. So the opposite of hyper is hypo. Then you have the acute thyroiditis, may inflammation, infection of the thyroid gland, okay, in the acute stage, and then yung matagalan for months, for years, may inflammation. We call that chronic thyroiditis. And then malignant nodules of the thyroid gland, there are usually 4: papillary, follicular, anaplastic, medullary. Okay, 4 usually. Ang pinaka-common is papillary and then follicular. Okay. Medullary carcinomas are usually not common here, but it's usually common in the US, no? United States. So, mas common pa yung anaplastic carcinoma, but this is not so common compared to papillary and follicular. Pero between the anaplastic and medullary, mas common yung anaplastic. And then, of course, pag may nodules, aside from the cancer, you can have non-cancer, non-malignant nodules. So we call that colloid cyst. May fluid lang siya. And then colloid adenomatous nodule, a combination of may solid, may cystic component like may fluid. Then multiple colloid adenomatous goiter, maraming nodules, no? Okay, dalawa, tatlo, apat, either on one side of the thyroid gland of the lobe or on both lobes. And diffuse colloid adenomatous goiter mean yung walang bukol-bukol pero lumalaki lang siya, no? Okay. Pero hindi siya hyperthyroid, hindi siya hypothyroid. And what are the causes of goiter? In general, we have identified the following risk factors, but we cannot, we don't know the exact cause. Okay? So the risk factors will be a genetic predisposition. Okay? It may run in the family, and of course, the environmental influence. Okay? Like lack of iodine can cause can cause goiter. Excessive exposure to radiation, which can cause cancer, and of course, stress can also cause some disorder of the thyroid gland. Okay. More specific causes, and for more specific diseases, example, when you have a so-called iodine deficiency goiter, ang cause noon is lack of iodine intake. But nowadays, because of the lahat ng mga pagkain natin o yung mga salt are usually combined, are supplemented with iodine, kaya bihira na yung iodine deficiency. Colloid adenomatous goiter, usually this is physiologic and degenerative conditions, no, because of stress, because of aging, because of growth and development. Then cancer, again, it can be caused by genetic mutation with genetic predisposition and radiation. Yung mga masyadong excessive exposure to the radiation. Chronic thyroiditis, this is an autoimmune disease, which we also cannot know the specific mechanism. Acute thyroiditis may infection. This is not common, but it can occur. Hyperthyroidism is also another type of autoimmune disease, and hypothyroidism, it could be due to iodine deficiency or sometimes physiologic or aging. So except for iodine deficiency goiter, which is due to the lack of iodine intake, which can be prevented, for other diseases, nobody can predict when one is going to have a thyroid disease. And two, the causes realistically are difficult to identify and to control. So healthy lifestyle with adequate iodine intake is the best bet against thyroid diseases. Yan lang magagawa natin. Healthy lifestyle, tapos may tamang amount of iodine intake, no? Yan lang best bet natin against thyroid diseases. No? So there's a percentage that one cannot prevent thyroid diseases from occurring even with a healthy lifestyle. Yeah, there's a kasabihan, even with a healthy lifestyle, it cannot guarantee no diseases 100%. But at least mga 70 to 80%. Kakaroon ka ng prevention of all the diseases. May mga 30, 40%, probably 30% hindi mo talagang ma-avoid. How to recognize goiter and its different types? Okay. First of all, ang pinaka-common, lumps on the front, sa harap at base. Ito, hindi sa itaas, hindi sa chin area, pero sa baba, no? And central neck sa gitna, which moves up and down with swallowing. Kasi itong, bakit up and down? Kasi itong thyroid nito, nakadikit, medyo intimately related to the trachea. Pag lumulunok tayo, yung trachea, or windpipe, trachea is the windpipe, maakyat baba yan. No? Kaya sumasama siya. No? Okay. So, pag merong bukol dit sa leeg at umaakyat baba when swallowing, usually that's part of the thyroid. It's coming from the thyroid. Yeah, whenever doctors examine patients with thyroid concern, we usually ask them to swallow. Okay. Now, the other common presentation is the lump on the side of the neck. It's a side, no? But not as common as the one on the front. Kung merong bukol sa side, tapos may bukol sa gitna, most likely cancer yung sa thyroid. Palpitation, ito yung mga symptoms, no? Usually symptoms of hyperthyroidism. Sudden weight loss, hyperthyroidism din ito. Okay, but most it could be due to other causes, not only hyperthyroidism, like stress, no? Ganon. Persistent fatigue, and then this is usually usually caused by hypothyroidism, no? Okay. So ito yung mga symptoms that you will use to recognize goiter. May bukol sa leeg, no, sa side, sa gitna, and then symptoms of palpitation, sudden weight loss, and persistent fatigue. Pag meron itong palpitation, sudden weight loss, and persistent fatigue, at meron kang nakitang diffuse diffuse goiter, most likely galing doon sa thyroid, no? Pero kung minsan maliit pa yung thyroid disorder, meron na yung palpitation, sudden weight loss, and persistent fatigue. Okay? In which case, you still suspect hyper and hypo. So, persistent fatigue, as I said, this is a signal or a cue, baka mayroong hypothyroidism. So the next step is to examine the thyroid gland, ipalpate lang kung may diffuse enlargement of the thyroid gland, most likely you are dealing with hypothyroidism. Ito naman, kung may palpitation, sudden weight loss, no, which are the alert symptoms, signals for hyperthyroidism. Okay. So kung meron, magkinapa nito, usually diffuse din. Okay. As I said, yung diffuse goiter, ang sinususpetsa niya, it's either hyper or hypo. Okay? Hyper kung merong symptoms siya ng palpitation, sudden weight loss, and then yung isa naman, hypo kung may persistent fatigue. Sa mga bukol naman, sa leeg, no? So these are the cues for tumors which could either be malignant or non-malignant. So kailangan pa ng ibang sign cues to be able to determine exactly whether it's cancer or not. Now, what are the paraclinical diagnostic procedure that are usually done for goiter? When you say paraclinical diagnostic procedure, is after the clinical test. Now, clinical means based on the signs and symptoms, wala pang laboratory. And then after that, if there's a need for laboratory test, then we do that. We call that paraclinical diagnostic test. So what are these tests? So the common instrumental and laboratory diagnostic procedures that can be used after the clinical diagnosis of the goiter would be one, thyroid function test. Usually we order T3, FT3, FT4, TSH. Okay? So by the phrase itself, thyroid function test, this is done to test whether the patient is hyper, hypo, or normal, or euthyroidism. Now yung imaging procedures are usually done to determine the structure kung may mga bukol-bukol na. No? So ultrasound is one of the imaging procedure which is probably the cheapest among the others. Thyroid scan, okay, meron pang gumagawa nito pero it's not very commonly done. CT scan can be done but this is too expensive and not the first line of imaging. May MRI, may gumagawa rin, PET scan, meron din. No? Then, yung mga needle biopsy, needle aspiration biopsy is another diagnostic laboratory. As I said, it's instrumental. Ito, you can call it diagnostic test. Ito, instrumental diagnostic test. Kasi may procedure yan. No? This is usually done for mga bukol-bukol para to determine whether it's cancer or not. So tatlo, thyroid function test, imaging, and needle biopsy. So thyroid function test, as I said, this is to check the level of the thyroid hormones in the blood, then to check whether the patient is normal. We call that euthyroidism. U is normal. Then hyper means sobrang daming hormones. Hypo, kulang naman, sobrang kulang. Okay? So indications for doing this thyroid function test when you are not sure whether a patient has hyper or hypothyroidism or even euthyroidism. Kung di sure just based on examination, clinical examination. And then when you need to have a baseline or follow-up value to monitor subsequent medical treatment, that means a patient's being diagnosed with hyperthyroidism through the thyroid function test, tapos binigyan mo ng gamot, gusto makita kung hanggang saan bumababa yung values. No? This is what is meant by monitoring and follow-up. And then interpretation of this test will be the following. Usually we use the T4 and the TSH. Kung normal ang T4, FT4, and normal TSH, then we call that normal function test, euthyroidism. Kung elevated, mataas ang T4, pero mababa ang TSH, baliktad, ang mataas, mababa ang TSH, hyperthyroidism ang sinususpetsa. Suspetsa, ha? Hindi pa 100% sure. Then, kung mababa naman yung T4, kasi kokonti yung thyroid hormones, at mataas yung TSH, then we suspect hypothyroidism. Okay? So, this is how we interpret the thyroid function test. Imaging naman, mga imaging, okay, when to do it? When we need to evaluate the structure, whether it's cancer or not, or whether it's cystic or yung whether it's cancer, okay. And at times, kasi andito yung PET scan can be used to test the functions, but usually PET scan is madalang gawin yon, mga may cancer lang ginagawa dyan, no? Okay. So as mentioned, there are ultrasound, thyroid scan, CT scan, MRI, PET scan, maraming pwedeng gawin, but the doctor will have to choose the most cost-effective one. Ano yung pinaka-mura at pinaka-informative. Kung ultrasound pwede na, yan ang muna ang gawin. Kung kailangan gawin ng iba, then that's time we do the other test. So here, this is the ultrasound, showing the ultrasound, how it's being done. Wala namang sakit dyan. And then, ito thyroid scan, may inject ng dye. Then makikita yung tinatawag na cold nodule. Ito, may uptake block ang kulay, pero isang area na may bukol na walang uptake. That's what we call cold nodule. Dito naman, hot nodule, sobrang daming uptake compared to the surrounding. So usually this is indicative of a hyperthyroidism. Okay. Now, needle aspiration biopsy. So indications when needed to determine whether a nodule is solid or cystic. Okay. If cystic, needle aspiration may be therapeutic in the outcome. No? Okay. So, cystic meaning fluid. Kung fluid siya, most likely it's benign. Okay. And then, the needle aspiration can be done to tanggalin yung mga tubig para lumit yung bukol. Kaya may therapeutic outcome. If it's solid, then we have to submit that specimen, like this one, for a needle biopsy, for a biopsy. So the needle aspiration is used also to get a sample of the solid nodule for biopsy. So whether it's benign or malignant, and at times, makikita mo natin just by looking at this one, by experience of the doctor, malalaman niya kung cancer or hindi. No? Okay, what are the usual treatment for the different types of goiter? Watchful waiting, meaning hindi kailangan operahan, hindi kailangan gamutin, bantayan lang. That's one option. Second option is medications, gamot. The third option is operations. Fourth option is RAI therapy. This is usually done for cancer and also for hyperthyroidism. Then chemotherapy can be done, but usually for bihirang gamitin yon. This is usually done for advanced thyroid cancer. So ang pinaka-common dito is watchful waiting, medications, and operations. Mas uncommon is RAI. Pero quite common din, but not as common as these three. Chemotherapy, very, very rare na gamitin. No? Unless talagang advanced yung thyroid cancer. So, goiter treatment for the non-cancer goiters. When you say non-cancer, usually it's hyperthyroidism or hypothyroidism. So goiters with functional disorders. Okay. And then goiters with non-functional disorders and benign conditions like colloid adenomatous goiter. So these three are not cancer. When you say hyperthyroidism, colloid adenomatous goiters, pag narinig nyo itong tatlong terms nito, hindi siya cancer. Okay. So the goal for treatment for these types of goiters, non-cancer, would be it's either curative or control, because some don't recur after treatment, kaya pwedeng cure yun, but some will recur. So control na lang ang hinahabol natin. So only time will tell which one will occur. And then in all treatment, there's no guarantee of cure. And then if there might be a need for a lifetime maintenance medications, like for colloid adenomatous goiter and also for hyper and hypo, baka kailangan lifetime medications. Now, treatment for hypothyroidism, ito very specific na tayo. So usually medical therapy, hindi operasyon. Kasi pag tinanggal mo pa yung, pag tinoperahan mo yung thyroid, lalong ma-aggravate yung hypothyroid kasi wala na yung thyroid gland. Okay? So ang treatment is replacement. I-replace mo lang yung hormones na hindi lumalabas sa thyroid gland ng isang pasyente kaya naging hypo. So i-replace mo with thyroid hormones which are artificial. Okay? Usually, ang pangalan nun is levothyroxine, and usually lifetime. Kung permanently hypothyroid isang pasyente, lifetime inuman yon. Hyper naman, 3 options for treatment: medical therapy with anti-thyroid drugs, operative therapy, and radioactive iodine therapy. Now, for huge, mga malalaki na, operative therapy is recommended right away. No? Pero yung mga maliliit, you can start with medical therapy. Kung di kakayanin, you can go for operative therapy or even radioactive iodine therapy. Now, for colloid adenomatous goiter, this is actually, you can call it the most common, I guess. In practice, we see a lot of this one. Okay. So there are 4 categories of this colloid adenomatous goiter. One is the so-called diffuse colloid adenomatous goiter. Walang bukol-bukol, pero yung 2 lobes are almost symmetrically enlarged, but the patient is not hyperthyroid or not hypothyroid. And then colloid cyst, may isang bukol dyan, may laman na fluid. Then solitary adenomatous goiter or nodule. Okay, may fluid at may solid component, but the solid component still benign. And then multiple colloid adenomatous goiter, it's a combination of colloid cysts and adenomatous nodules. Marami siya, 2 or 3 or 4. Okay. So option here will be, as I said, these are benign. Kaya pwedeng kung maliit lang, pwedeng monitor without meds, or pwedeng bigyan ng medicine kung medyo malaki na at ayaw ng operasyon, no? And then operasyon. So definitely operation is recommended for huge size goiter, and small to moderate ones, no operations may be done. Monitor without meds or with meds. No? So ito yung mga options. Now, surveillance or monitoring is needed, usually lifetime when you treat this kind of diseases. No? And then for the thyroid cancers, as I said, 4 common types in the Philippines: papillary, follicular, medullary, and aplastic. Okay. So the usual goal of thyroid treatment will be you eradicate the known tumors and cancers entirely, preventing the recurrence or spread of the cancer, and then relieving the symptoms of all reasonable curative approaches that have been exhausted, if all. No? Okay. This one is parang palliative na lang ito. Yung pangalawa, operation can still be done, okay? Or treatment can still be done to palliate. Kung medyo advanced na, just try to see if you can palliate para matanggal yung mga symptoms of obstruction and other symptoms, no? Okay. So, but for the curative goal, kung talagang hoping for cure, the primary treatment modality is still operation. No? Ito yung una. No? Mga papillary, follicular, medullary, anaplastic, kung itong dalawa, ito usually kayang operasyon. Ito naman, depende sa stage nito. Okay? So after the operation, this may be followed by radioactive iodine therapy depending on the situation, kung may naiwan, kung gusto ng doktor na para sigurista na hindi na siya babalik, then they can add radioactive iodine. Or they can also be followed with the use of medical suppressive therapy like levothyroxine. This is to avoid a recurrence. Now, for palliative goals, usually, ito yung ginagawa, chemotherapy and radiation therapy. Radiation means yung mga external radiation. No? Okay. When you talk about operations naman, we talk about total, subtotal. Kung yung cancer involves only one lobe, pwedeng subtotal lang. Kung yung cancer involves two lobes, usually total na yan. No way out but to remove the entire one. Kung minsan naman, kadalasan ng mga doktor ngayon, pag may isang thyroid cancer in one lobe, they also do total already. No? Okay. Neck dissection, there are different kinds, depende sa mga lymph. When you say neck dissection, usually done for yung mga nagkumalat dito sa kulani, sa leeg. No? Yung marami siya, then you can do the selective, more conservative neck dissection. Kung marami, you have to do a radical neck dissection. So operation pa rin ito. No? So operation on the thyroid, operation on the lymph nodes. What are the post-treatment management after the treatment? So after treatment of any type of goiter, either non-cancer goiters or cancer goiters particularly, there must be surveillance or follow-up or treat or check-up, usually lifetime or for recurrence. Okay? So kahit na hindi cancer, usually lifetime din ang check-up. So the purpose for the surveillance here will be early detection of for any recurrence that may occur, and then early treatment, and then with early treatment, there is a great possibility for better outcome. Okay, but no guarantee. And patients may be taking maintenance meds for the control of the disease, and then this may be lifetime. No? Okay. Most of the thyroid patients with thyroid cancer usually lifetime maintenance yan kasi usually total thyroidectomy, kaya meron siyang replacement. Now, and then also patients are advised to have healthy lifestyle to promote health restoration and maintenance. Except for anaplastic thyroid cancer, which is the worst type of cancer, fortunately it's rare, and other advanced cancer in papillary, follicular, kung di na naagapan, kung giging malaking-malaki, advanced na rin yun. So, except for these two categories of cancers, the rest, yung mga maagang na-detect, maagang nagamot, so the rest can still have a long life after treatment. 30, 40, 50, usually, kumisan, ano pa, yung di sila namamatay dun sa sakit ng cancer, but from other diseases. So, summary and takeaway, I've discussed the following. What is a goiter? What are the different types of goiter? What are the causes of goiter? How to recognize goiter and its different types? What paraclinical diagnostic tests? What usual treatment? What are the post-treatment management for goiters? I've discussed these basic topics. Takeaway in relation to patient empowerment, be always in touch with reliable medical information on thyroid goiter. Knowledge is power, it gives power. Use the 4Ks for patient empowerment, kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in the medical management of thyroid goiter. So with that, I end my pep talk this afternoon. I hope I have empowered you to have a basic understanding of thyroid goiter in your health management. Reminder before we go to the question and answer. Okay. So take the online learning curve evaluation test exercise for mastery of learning and have a perfect score to get a certificate like the one shown here. I placed the link in the chat box. And then 50 OLETE certificates will entitle one mentee to one voucher for a medical consultation, either face-to-face or telemedical. Then please type in your feedback in the chat box during the open forum and before we adjourn. So let's now have a group picture taking before we start the question and answer and interactions. Ready? Everybody ready? 1, 2, 3. Okay. Let me save this one first. Okay. We still have 10 minutes to go. Okay, so any questions on the topic? Comments? Free consultations?
Doc Hoson.
Yeah, rabies.
Not a question but ano po, side comment. Napaka sakto or appropriate ho ng topic nyo ngayon about thyroid diseases or goiter. Kasi today is the feast of Saint Blaise, who is
Yeah.
the patron saint, of ng mga may thyroid diseases. Kaya
Yeah. Okay.
very appropriate and relevant.
Yeah. Thank you. I didn't
Doc,
think of it. Yeah.
akala ko sinadya nyo po. Hindi.
Hindi, hindi ko naisip 'yon. Ang naisip ko lang, hinabol ko lang yung yung DOH calendar. Actually,
Okay.
medyo nahuli nga ako February na ngayon. The last week of January di ba?
Doc, meron po akong message sa inyo sa Viber at saka sa
Nasagot ka na?
cellphone. Hindi ko pa ako nakikita.
Okay, nasagot
Sige.
ka na. Okay.
Thank you po.
Okay.
Thank you.
Okay. So I didn't ano yan, Saint Blaise, no? Saint Blaise, we're honoring Saint ngayon, Saint Blaise, di ba? Okay.
Opo.
So, actually, I went to Mass this noon. Nagpa-blessing nga rin ako
Nagbabless sila.
Di ba may candle? May candle na So, it's in the same place. Alam ko for the throat, no? Patron saint for the throat, no? Pero sinama yung nung binabless ako ng pare, sinama na niya lahat. Throat and other diseases. Okay. So, akala ko hanggang throat lang. Baka yung mga voice. O baka yung sa'yo, may sakit ka sa throat, kaya inuubo ka. Okay. So, any more comments?
Doc, ako.
Okay.
Yeah.
Maria, Husta.
Yes. Doc, I want to share something. I think it's very appropriate also. It was sent to me by my sister-in-law. It seems that thyroid cancer is one of the fastest growing cancers, especially sa US, in women. No?
Fastest?
It turns out po kasi
Fastest?
one of the fastest growing in women in the US.
Okay.
Now, it turns out po, they suspect it's because of the dental x-ray and mammograms. So, radiation. It turns out po pala, if ever we are going to have a dental x-ray or a mammogram, there is a thyroid guard that we must ask for. It's yung dental x-rays, there is a little flap that can be lifted up and wrapped around your neck. But many dentists don't bother to use it. Tapos, same thing daw sa thyroid, for mammograms. This lady said she went to for her mammogram and she felt silly, but she asked about the guard for the thyroid. And
Oo.
sure enough, the technician had one in the drawer. So I asked, why isn't it routinely used? Ang sagot ko sa kanya, oh, I don't know. You have to ask for it. So, so we should, I guess, we should remember if ever we are going for a dental x-ray or our mammogram, we should ask for that thyroid guard
Yeah.
to
Okay.
minimize radiation.
Yeah.
Yun.
Okay. So thank you for that input. No? Okay. Of course,
Opo.
not everybody will kakagat yan, di ba? Okay. But that's an information that we have to consider. No? Okay.
Mm-mm.
Number one, kasi okay, comment ko lang. I don't know what it's meant by fastest. Fastest. No?
Yes, oo, yun rin eh. Basta,
Ano, kaya nga, ano ibig sabihin ng fastest? Marami? O maraming may
marami,
thyroid?
oo.
Maraming
Lumalaga.
thyroid cancer. Mas marami pa rin
Nagkakaroon.
ng breast cancer eh.
Ay, oo. For
No?
sure po.
Kaysa thyroid cancer.
Mm-mm.
Okay. Nag-e-echo, no? Nag-e-echo
Nag-e-echo
ba?
ka, Doctor.
Sa akin ba yun?
Yes, it's yours.
Wala ko sa akin. You're okay on my
Okay.
end.
On your
Yeah.
end?
Yan, okay na.
Okay.
Yan, oo.
So, okay. So, anyway, yun pa lang, baka
So we
may
should-
mag-argue, baka wrong information, not the fastest, di ba? But probably they can say we have noticed that there is a increased number of thyroid cancer after dental procedure, no? Ganon. After mammography, no?
Her
Okay.
words here are, had a show, this Dr. Oz had a show on the fastest growing cancer in women, which is thyroid cancer.
Aha. Okay. Sige, let's just
Yeah.
assume na concerned sila sa maraming thyroid cancer and breast cancer. No?
So always ask na lang if they have that
Yeah.
guard.
Yeah.
So
Okay,
when
but
you
in
go for
general,
that, they can
kaya nga, in
put it-
general, exposure to the radiation is bad also, di ba? Okay, so you just have to avoid it as much as possible. Okay.
Mm-mm.
Yeah. Kung pwedeng i-prevent, no, i-prevent lang yon. Okay. Thank you for that input.
You're welcome po.
I don't know kung meron tayong, alam ko yung ibang dentist.
Kasi, no.
Dentist, nagda-dental sa hospital, yung mga dental x-ray, may portable sila, no? May portable x-ray sa clinic kung minsan, no? Okay. Yeah. Pero yung mga
alam ko.
panoramic x-ray ang very popular.
Panoramic po. Opo.
Usually sa hospital na base na yun eh. O sa big center. No? I suppose they should have some shield on the neck. No? Okay.
Dapat po.
Okay. Yung
I know that
yung sa
the
Japan, di
dentist
ba? May
in-
explosion ng mga yung Chernobyl, yung mga ganon, Chernobyl sa Russia, Chernobyl. And then
in Russia.
yung
Sa Japan,
hindi, sa Russia yon. And then sa Japan, I think because of the yung World War II na ano, yung bomb. Okay? Okay. So there were a lot of reported high incidence of thyroid cancer after yung mga bombing, mga nuclear bomb, no? Ganon.
sa Hiroshima.
Hiroshima, yeah. So that's why it says that there's a danger for thyroid cancer due to excessive exposure to the radiation. No? So in peacetime naman, hindi sa gera, so I guess yung maraming x-ray dyan ng katawan, that can also lead to thyroid cancer. No? Ano ba gina-x-ray na malapit sa neck? Dental and mammo. No? Dental and mammo. Dati yung mga tonsils. History-wise, yung tonsils niraradiate din eh. Yun ba? Ngayon, di na. No? So maraming kaso ng thyroid cancer din noon, no? Okay. Okay. Any more?
Doktor, ako. Meron kasi yung anak yung caregiver ng mother-in-law ko, but she is based in Surigao. So, pinadala lang niya sa akin yung result ng FT4 and TSH. Yung October 2023, yung FT4 niya is 11.44, TSH is 5.05. Kaso, ngayong nagpagawa uli siya ng blood test, hindi kasaming FT4 eh. The TSH is 0.829. So, may iniinom siyang gamot. I asked her, I gave her the link to join us, pero parang wala siya. I don't know. Hindi ko
Okay.
tuloy matanong kung ano yung other test or yung gamot na iniinom niya nung binigay nung October.
Okay.
Pero
yan.
yung video na pinakita niya sa akin last year, medyo protruded talaga yung kanyang neck. Ewan ko lang ngayon kasi doon sa gamot na ibinigay, as I see, parang bumaba na yung TSH niya before. So, I invited her para magkaroon siya ng consultation with you kasi nga nasa Surigao yung bata.
Ilang taon na yung bata?
Ano na siya I think first year college
Okay.
siya. So yung mother niya kasi is in Batangas. Kaya sabi ko, mag-join in para matingnan siya through this platform.
Yeah, mas maganda nga kung nag-join na lang siya, no? Para may
Kaya
free
nga
consultation pa siya. Saka makita ko
Oo.
siya, makita ko rin siya. Kasi
Kaya
mahirap mag-interpret kung anong diagnosis to start with. Kung gamot ang binibigay, ina-assume ko na lang baka benign, no? And then pag may gamot, yung laboratory test mas ma-alter talaga, no? So pag umiinom ng levothyroxine, yung TSH bababa, no? Kasi pag bumibigay ng levothyroxine, parang parang nagsisimulate ng hyperthyroid kasi binibigyan mong maraming hormones. Kaya bumaba ang TSH, no? Ganon, no? Anyway, convince her to join para dumami.
Kaya I don't know if Patricia, are you related to Sheila May?
No, si Espino ito Kilala ko si Patricia.
Okay.
Patricia Espino,
I'm
di ba?
sorry. Oo, kasi Surigao kasi yun baka siguro nagkakaroon ng
Sorry.
Patricia Espino ka, di ba?
Yes po.
Okay, I'm sorry.
Not related. Any question, Patricia? Okay, thank you for attending.
Yes. Thank you po. Wala po po question.
Okay. So, any more questions? Tandaan na lang, goit kasi maraming tatanong palagi. Ano ba yung goiter? Goiter is any disorder of thyroid gland. Dati-dati, ang connotation ng goiter, benign lang. No? Pero ngayon, loosely speaking, lahat pwede. No? Okay. Ika-clarify na lang. No? Okay.
Yeah. May tanong ako.
Oo. Yan, may goiter din sino.
Si Meli.
Meli, may goiter ka.
Hi po.
Okay.
Tanong ko lang, bakit yung mga doktor, pag nagpapa-blood test sila, usually, ang nilalagay lang nila, T3, T4, TSH. So, what's the difference between FT3 and T3 and FT4 and T4? May difference ba yun? Kasi sa'yo, Doc, FT4, FT3. Pero usually sa doktor, ang nilalagay nilang blood test is only T3 and T4. Yun ang common.
Maraming klaseng test dyan. Okay. Parang dun sa mga calcium, may free calcium, may mga serum combined calcium. Ito naman, yung when say free T4, yung T4 na hindi naka-combine sa mga proteins, no? Yung substance sa blood, ganon, no? Yung T4, TSH, yung lahat, no, overall, no? Okay. So iba-ibang test 'yon, no? Okay. So some would say that this is FT4 and T3 is more accurate than T4 and TSH, no? T4 and T3. When I say T4, T3, parang overall, parang parang dekahon, yung buo, no?
Oh.
Okay. Parang shotgun na ano, no? Hindi niya hinihimay, no? Ngayon, pag FT4, yung free, F is free, free T4 lang, no? Ganon, no? Pero interpretation, dapat pareho, halos pareho lang ng interpretation, no? Ganon.
Magiging parehas ba ang value ng T3 and
Oo,
FT3?
oo, oo, oo.
Same lang.
Iba-ibang values niyan. Kaya dati when I was a little younger as a doctor, usually we have to memorize the values. Kaya during that time, isang laboratory standards. Ngayon ang daming laboratory equipment na may kanya-kanyang value, no? Yeah, I don't memorize the normal values anymore. I just ask, ano ba yung normal range ng laboratory? You have to ask the laboratory, anong ginagamit nilang range, no? Okay.
So anong mas accurate na test of T3 o FT4 or F4?
Yung pinaka more specific,
T4.
FT, yung may F, more specific.
May-
Yeah. Kasi yung T4, T3, may nakadikit pa yung mga ibang substance doon no?
Okay.
Pero usually in the end, you have to connect it to yung symptoms ng pasyente. Kasi kuminsan yung mga laboratory, kuminsan may mali din yun, no? Okay. May mali, no? Parang yung kanina, may inooperahan ako kanina kasi ang mababa ang TSH niya, pero clinically, yung wala naman siyang nararamdaman. So kasi bumababa ang TSH mo, sabi mo hyperthyroidism, di ba? So pero tinitingnan ko naman yung pasyente, wala siyang nararamdaman, kaya sabi ko, normal lang yan, baka mali lang yung laboratory. So kung di kailangan yung mga laboratory test, wag nang gawin kasi marami ring mali yun no? Okay. Siyempre ayaw ng laboratory marinig yung mali, pero talagang sasabihin nila variations lang yon, variations ng katawan, no? Okay. So pag may mga laboratory test, kasi pag may konting abnormal, nako hindi ka na makatulog, hahabulin, i-disprove mo, di ba?
Second question. Nanood ko yung sa TV, yung sa, ewan ko kung saan yun, sa isang province na, kasi goiter month yata, ng January, itong January. Isang province na nag-help sila ng free goiter test sa mga babae. Tapos, meron silang tinetest ng iodine, yung asin daw na ginagamit ng mga housewives sa households na iodine content. Tapos merong silang machine na sinishake na nakita ko lang sa TV. Tapos sabi nung doktor na doon, sabi niya, kulang daw sa iodine yung asin na ginagamit niya sa pangluto or anything. Ganun ba yun, Dok?
Meron. Sa Pilipinas, sa mundo, maraming kanya-kanyang diskarte, no? So, as I said kanina, personally, I don't believe iodine is a major cause of iodine deficiency goiter. Ang goiter natin ngayon is not due to iodine deficiency na, no? Okay, dati kasi wala pa tayong iodized salt, di ba? Okay. So ngayon, I personally don't agree that iodine deficiency is a common cause of goiter. No? Probably mag-entertain lang ako ng iodine deficiency goiter kung yung isang pasyente nasa bundok, no? Walang kinakain na mga isda, mga seafoods, no? Then pwede pa, no? Okay. Yun ang observation noon mga 40, 50 years ago, ganon, no? And nung pumasok na yung mga iodized salt, yung mga ganon, no, wala na yon, dapat wala na, no? Okay.
Thank you,
So
Doc.
huwag kayo maniwala dun sa iodized na, no? Basta kung if you want to prevent iodine deficiency goiter, kahit may salt ka lang, iodized salt, no? Okay.
Yes, Doc. Sige. Thank you, Doc.
Okay. Any more? Wala na?
If there is any question, can I have the floor?
Wala na? Wala nang tanong? Okay. Kung wala nang tanong, before we go to, may sasabihin nata si Abet, no?
Yeah,
Pero
I'm
i-announce
just
ko lang.
going to share a
May announce
video.
lang ako. Yeah, may announce lang ako muna. Yung sa OLETE certificate, no? No, I'll just show it here. Ha, sandali. Okay, nakikita niyo ito?
Yes, Doc.
Okay. So, kagabi, kinompile ko na yung yung mga OLETE certifications, no, that we have incurred from May 15, 2021. That's when we started, no, up to December
Bakit
31,
kulang ko?
2023, no. So, may mga 67 mentees na nagkaroon ng at least one OLETE certificates, no. So, ang top 10 nito is Phoebe. Andiyan ba si Phoebe? Phoebe, 127. Kompleto, no? 127 ang total. Perfect, no? Okay. Kasi up to December 31, we conducted 127 pep talk, no? So, si Jocelyn, 124. Perla, andyan, no? 123. Jeng De Castro, 123. Si Reyes, 121. Beth, 116. Elena. Okay. Maria Justa
Bakit
Poloda,
kulang ako?
98, 96. No? Okay. So, marami yan. Kinompile ko na lahat. No? Kasi mahirap balikan na yung no? So, from 2024 onwards, I will have a new policy na kasi mahirap mag-backtrack ng yung iba kasi humabol-habol pa, matagal na, last year pa, no? So starting 2024, okay. Pwede po yung iba, yung idadagdag ninyo, kunin na lang niyo from this year on, no? Kasi sabihin natin yung if you want to increase your certificates, wag niyo balikan na yung old pep talk, no? Okay. Kasi mahirapan ako to keep track, no? Okay. Gagawa pa ako ng certificates, no? So let's just move forward, no? We just bank on January 24, pwede pa mag-backtrack kasi February na ngayon, no? So pwede pang habulin, no? Okay. So after this talk, I will just allow 2 weeks na lang. 2 weeks pag i-review ko after 2 weeks kung meron pang humabol o wala. Kung wala na, i-close ka na. No? Hindi ko na hahabulin na every week maglo-look back ako, no? Ganun, mahirap, no? Okay? Is that clear? Okay na sa inyo?
Yeah.
Po.
Yes.
Okay. Okay. So, any questions? If none, Beth would like to say something.
Yeah, I'm just going to share a small video. Actually, we were planning to have a special or surprise birthday party for you, but you announced that you will not hold clinic January 30 because you are in Tarlac. So naon siya may yung aming surprise party for you. Dun sana sa clinic gagawin. So I just decided to make this video just for you to remember by. I mean, pag wala kang ginagawa, medyo tingnan mo just to make you feel kung ano yung mga tungkol sa'yo. It's just a short video. So please allow me na ma-share ko yon dito. I don't know if I'm going to post this sa FB or in any platform, but before I do that, with your permission. So dito ko muna ginawa sa RO, sa ating PEP talk. So I'm going to share it right now. Medyo may konting mali kasi doon sa huli, pero ayoko nang baguhin kasi pag binago ko, iba na naman ang masasabi ko So,
Hirap yata gumawa ng video.
kaya nga So, sandali lang, ayusin ko lang
May share screen ka na? May share screen?
Yes. So, share screen. So, wait a minute. I'm going to need help from my So, spare your time. Balikan ko lang. Where's the book? Nawala siya Nawala So, stand by. Naka-ready na to kanina kaya lang medyo nawala yata.
Baka umiyak ako niyan.
Marunong ka bang umiyak? Kaya nga na-download ko ba't nawala? Ay, siguro dito. Wait lang Na-practice ko na kanina Wait a minute. Na-super excite lang siguro. So, sa download. Here. This one. Yeah, this one. Yeah. So, ito. Tapos i-share ko na. Oops.
Birthday tribute to Dr. ROJoson, January 31, 1950.
Here. Okay. Zoom. Siya lang kasi ang techie So, again, here, the share screen.
Shared screen.
Sound. This one. Hope you like this.
Nasaan? Wala.
Here. A birthday tribute to Dr. ROJoson, January 31, 1950. A husband to Jacqueline Judith E. Hoson. A father to Dr. Ray Benjamin E. Hoson and Marie Therese E. Hoson. A friend, a UP College of Medicine PGH graduate batch 1974. A friend to Letty Kwan and Willie Tong, amongst others. A mentor, an educator. A hero to all his patients and among his cancer survivors' patients. A mentor who shared his knowledge and know-how without any hesitations. In my eyes, as your secretary, I have witnessed your evolution as a person, a husband, a father, and as a physician. How we started to have no patience in a day until you reached the momentum of your career up to this day. How you serve your patients from with professional fees to charities. As I watch you bloom to being a surgeon, to a famous surgeon, you continue to excel in every field you took. From being the assistant medical director to vice president in hospital administration, combining administrative works to being a surgeon. You are well equipped both as a surgeon and hospital policy administrator. Several times you have proven your worth in both fields, but not in all things that you expected. You felt deprived of the recognition you deserve for all the hard work you did, but you stand tall. You took the pride of continuing what is best for you. For more than 3 decades as your secretary, I can only say your contentment and simplicity describe you as a whole. You never asked for more. You always thought of your patients' welfare and well-being. You are not perfect. You may have your flaws. You made mistakes, but all this makes you human. For all the years that I have served as your secretary, I have known you through your success and failures, your deep thoughts in tiring and well-off days. More years from now, you may not be able to appreciate what impresses you, what made you, and who you are. I made this for you to know how we value and how much worth you are as an exceptional surgeon and person. Your being you lingers as a testament to your unwavering dedication and inspirational guidance. Your personality is marked by integrity and compassion, has shaped not only our professional growth but also a collective spirit. Thank you for being a beacon of your inspiration to all of us. I will always remember you as simply Dr. ROJoson. Happy 70th birthday to you.
Hello po, Dr. Roson. Happy birthday po. God bless po and long life to live po.
Hello po, Dr. Roson. Happy birthday. God bless.
Hello po, Dr. Roson. Happy birthday. God bless po.
Happy birthday, Dr. Roson. On your 75th milestone birthday, I wish you many more years of good health and abundant blessings. You are such a blessing, a God-sent doctor to all of us, your patients. I personally would like to thank you sincerely for being an important part of my cancer journey for 25 years. I am so grateful for all the knowledge and skills you have imparted to us, your patients, through your pep talk and other medical programs and advocacies. Thank you for making us empowered patients in so many ways. Again, happy birthday. Have a wonderful one and God bless you more.
Happy birthday, Dr. Roson. Kami yung Cancer Crusaders Club.
Okay.
So that's it.
Thank you. Thank you. Okay. 75th birthday. Tama si Radis.
Kasi
Ilan?
ano yun eh,
70.
pinag-usapan kasi yan nung Christmas party nung kay Dr. Dancel. So, parang may piniprepare sila na parang surprise greetings or meet and greet nung birthday mo. But unfortunately, you announced that you're going to be in Tarlac. So, they asked me sabi ko, hindi ko na nagawa eh. So, just recently, I made this video. Kasi hindi ko I really don't remember now yung binigay ko sa yung letter noon, yung hiningi mo para sa eulogy. I mean, that was before. So maybe sabi ko nga siguro ito yung pwede. Madami kasi pa yan eh, kaya lang dinilit ko kasi sobra-sobra na sa sa load ba, yung load na tinatawag. So, yan ang naging outcome. Hope you like it.
Yeah, I like it, of course, no? Baguhin mo lang yan, no? Yung,
Yung
yung ano,
70th. Kasi,
1949.
yeah. Naku, dyan ako madalas magkamali eh. Yung
Right?
date na
Hindi ako
pag-aano ko kayo ni
1950.
Dr. Rodici, siya ang 49, ikaw ang 50. Tsaka yung dulo, yung 70th, it should be 75th. So, ito
Tama si
nga, ang hirap.
Ladies.
Yeah, ang hirap kasi maggawa ng video pag paulit-ulit. So,
Yeah, mahirap. Oh, babaguhin mo ba?
yung
Yeah,
dulo, mahirap na, hindi na. Kasi,
Oh,
ano naman ni Ate Rice na 75 birthday mo na yun. So, ayaw
okay,
mo
thank
kasi
you.
ng mga celebration eh. Maybe that little thought will add to your memories.
Yeah. Nag-join na lang ako ng mission. Actually, I'll be busy with my mission. Kaya ladies, baka next will be February 26 na yung clinic ko. No?
Sige po. Thank you,
26.
thank you.
Kasi I'll be going to another mission next week, no, sa Carmona, and then after that, Romblon, no? Okay.
Wow, Romblon.
But we still have clinic on Tuesday?
This
You're going
Tuesday
to Carmona na?
meron. After
Okay.
that, wala. Up to 20 ano na. So, bali 2 clinics lang tayo this month, no? Okay. Okay, thank you very much, Abet. Okay.
Hope you
So,
like it. And you can and keep it. Please keep it.
Yeah.
That's the only gift we can give you.
Ano ba yun? PowerPoint ba yan?
Yeah, PowerPoint. Pero kasi nga masyadong malaki, so pinaayos ko yan dun sa anak ni Christy eh. So,
Yung
yan.
dinab mo, hindi ko alam. Hindi rin, nahirapan din ako mag-edit mga ganun.
Oo. PowerPoint ko siya ginawa, pero inayos ng anak ni Christy yan eh, para maging ano yung volume, tsaka yung medyo may mga lapses kasi sa sa video, yung parang putol. So, and it turned out that way. Medyo maganda siya.
Sige. Okay, thank you very much. I appreciate that video. No? Okay, thank you. Thank you also, ladies, for that malit na sharing. No? May mga
Welcome
pictures
po.
pa. Okay.
Would you allow us to upload it sa Facebook? Kasi
sige, i-upload mo. Para
okay.
para alam nila yung errors did not come from me.
Ayoko nang baguhin eh.
Okay.
Di ba sabi ko nga sa'yo, pag nagko-comment dun sa sa ulete, pag nagkamali ka, iba na naman. So ayoko na mag-ulit.
Okay. Okay. So before we leave, thank you, Abeta. Before we leave, yung olete, take the olete as soon as possible. I'll give you 2 weeks na lang allowance, no? Para hindi ko na ako pabalik-balik, no? Okay. Kasi it consumes a lot of my time, no? And then, yung breast self-exam awards, although the deadline, meron na nag-submit, no? So si Giselle, si Shirley, meron na, no? Si Chris, saka si Mayan Jose. So, I'm expecting more, no? So, I might move the deadline. Si Lorlier, okay, Lorly sasama din, no? So, I might move the deadline a little further. Basta maabot lang doon sa 9 months, no? Okay. Kasi importante yung 9 months na yun, which I cannot compromise anymore, no? Okay. Okay. Thank you. Thank you very much. We'll see each other again. I'm going to prepare for my next pep talk tomorrow. Okay. Okay. Okay na? Bye-bye.
Bye-bye po.
Thank you.
Bye, Doc. Happy
Bye-bye.
weekend. Bye.
Happy birthday po.
Thank you. Sino si Mel? I forget. Mel Cabrera ba ito?
Yeah, I think so. Cabrera.
Yes, Doc.
Nice to
Okay.
be back. Tagal ko
Oo,
pong
nice to
nawala.
see. Oo nga, nice to see you again.
Wala
Okay.
po akong video, kaya hindi ako makapag-on ng camera.
Okay. Pero naririnig mo ako? Okay.
Yes, Doc. Yes, Doc.
Okay.
Oo. Happy
Bebot is in
birthday,
the
Doc.
house.
Thank you so
Thank
much
you.
po.
Thank you. Thank you, Mel. Okay.
Doc, thank you sa certificate. At last, nakapag-avail ako ng PWD card.
PWD.
Yes, Doc.
PWD.
Thank you so much po.
Yung i-edit mo na ba?
Uulitin ko po talaga from start, Doc. Hindi siya kayang i-edit eh. Kumbaga parang bago talaga ang gagawin.
Ganun ba?
Yes, Doc.
Pwedeng video editor, di ba? Ibubura lang sige, try your best na lang. Sayang yung mo. Okay.
Sige, Doc.
Para
Sige, Doc.
i-present natin next, itong December.
Okay, Doc.
Sige. Okay,
Okay
thank
po.
you.
Sige,
Thank you
Doc.
very
Thank you,
much.
Doc.
Bye-bye.
Thank you po.
Bye.